Many kids in this country have a behavioral health disorder or a psychiatric disorder. In the neighborhood of 30% suffer from an anxiety disorder, 20% suffer from a behavior disorder, 15% from a mood disorder such as depression, about 10% a substance use disorder like drug or alcohol abuse. So in adolescence, it's perhaps particularly important. This is the period of life during which most serious psychiatric disorders can have their onset. So things like mood disorders such as depression or bipolar disorder, psychotic disorders which are relatively rare, anxiety disorders often have their onset during adolescence, and the same with substance use disorders. Substance use patterns that begin in adolescence can often lead to very serious addictions in the 20s and 30s and beyond. The difficulty in detecting psychiatric problems in teens is probably at the most simple level. It has to do with stigmatization. A common example, if you're depressed, that's something that people are less likely to talk about with their friends, their neighbors, their coworkers, fellow students in the case of a teenager. Another reason is that most people visiting their pediatrician or family medicine doctor are less likely to be screened for depression, anxiety. A depressed kid who is perhaps not aware that they're depressed, they're just kind of feeling lousy, but they haven't really identified it as depression. If that's not evident to the doctor, to the parent, to the teachers, and that depression becomes worse, that kid is going to experience fairly significant difficulties with social functioning and academic functioning, and ultimately could be at risk for suicidal behavior or even dying as a result of suicide. Suicide is the third leading cause of death in this age group, just behind accidents and homicides. Here in the Peninsula Coastal region of Sutter Health, Mills-Peninsula Health Services, the hospital where I work, and the affiliated medical group, Palo Alto Medical Foundation, are working hard to address this problem. There's a adolescent behavioral health project that we've been planning for the past couple of years and have initiated this year. What we're going to be doing is teaching primary care physicians, about 700 of them, to look for depression, to look for anxiety disorders, to utilize screening tools that will help them figure out which kids are at risk for substance use disorders. We're very excited about this for many reasons. First of all, it's going to improve the care for our teenagers in the PAMF clinics, and that's very important. It will reduce the burden of disease, and we think it'll save lives. This is a 5-year project. We're just in our very beginning stages of it. At a next stage, we're going to be doing some resource navigation, helping parents and kids who are seeking specialist care to get connected to that specialist care. And then we're actually going to put some psychiatric professionals into the clinics to manage, along with primary care, some of the conditions that otherwise might have been sent out of the clinic setting. I think if we do this right, if we do things like this project, and that can lead us and other systems like ours to big changes in how we provide behavioral health care, we will see a time when kids come into their pediatrician's office for a routine school checkup, and they will be screened for depression, substance abuse, anxiety, in the same manner that they might be screened now for things like diabetes, obesity. I am a psychiatrist. I believe in what psychiatrists do, but I think that it's going to be a more comfortable conversation talking to the physician who you've known your whole life, who you have that trust in. This person knows me, they know what I'm up against, and they know what my values are and what my priorities are. From my own experience, having been a patient over the years, it's easier to talk to somebody who you trust and who you know and who you believe knows you. And that's the way it should be for all problems, including psychiatric problems.